Hello, my name's Matt and I'm a physiotherapist at Princess Alexandra Hospital. This is a brief presentation about the benefits of physical activity and how to become more physically active after a cancer diagnosis. In the world today, people are living longer after a diagnosis of cancer than ever before. However, although people may be living longer, they are not necessarily living well. Physical activity has an array of benefits to people living with and after a diagnosis of cancer. Macmillan describes physical activity as the underrated wonder drug. This is evident by how powerful physical activity can be to improve quality of life and help people to live well. The encouragement to be physically active is often misunderstood by many people. You do not have to go to a gym or play a sport to be physically active. In fact, just by slightly changing your normal daily schedule, you can greatly improve how active you are. This can be done outside, at work, or simply in your own home. Exercise is not bad for you if you feel tired or sore. Being physically active can actually help you to feel less tired and more alert. Using pacing and balancing, you can be sure that physical activity is only beneficial. Finally, it is never too late to start being active. Changes you make now can help you immediately feeling and living better. Physical activity has potential benefits throughout every stage of cancer treatment and even after treatment has concluded. This is the same through a range of cancer treatments including chemotherapy, radiotherapy, hormone therapy or surgery. For somebody preparing for treatment, physical activity can make the body more resilient and dampen the impact of the side effects. For somebody who has finished treatment, physical activity can improve fitness, well-being and reduce the risk of recurrence. Cancer treatment can affect everyone differently, but many people report similar symptoms. Physical activity can have an immediate and remarkable impact on some of the worst symptoms of cancer and cancer treatment. Many people report fatigue to be the most significant side effect, and there is a lot of evidence to support physical activity in reducing cancer-related fatigue. Cancer-related fatigue is a different type of tiredness to that which most people know. It will most often lead to excessive rest, making muscles and bones weaker and joints more stiff, leading to further physical deconditioning and more fatigue. But physical activity can break this vicious cycle by having the opposite effect on muscles, bones and joints and reducing fatigue. More information about this can be found within the accompanying presentation on fatigue management. Unfortunately, low mood and anxiety and depression is a very common symptom of cancer. Physical and mental health are very closely connected, and physical activity has a very unique role to play in improving mood and reducing stress. Activity has been shown to actually be the best treatment for maintaining mental health. One way it does this is by releasing natural neurotransmitters in the brain, like endorphins, which can make people feel bright, elated, and reduces stress. Another way is by making people feel good about their bodies and giving people confidence. Many people have described the way that physical activity has made them feel happier and less anxious. Cancer treatment affects everybody differently. Some people have trouble with losing weight and others may gain weight. Physical activity has a direct impact on our body composition, and whether somebody has gained weight following treatment or lost weight, doing exercise can help to regulate this impact. Some types of cancer and cancer treatment can have a negative effect on the strength or density of bones. By doing weight-bearing activity, such as walking or jogging, the impact is reduced and can actually improve the strength of the bones. In addition to this, doing weight-bearing exercises to a certain degree of difficulty will increase the strength of muscles, which can have an effect that carries over into everyday life. By having stronger muscles, this makes tasks of everyday living, like housework or carrying shopping bags, easier and less strenuous. On top of all the benefits already mentioned, physical activity has also been shown to reduce the risk of developing other health concerns, such as diabetes or heart disease. The positive effects of physical activity on quality of life are not just immediate, but go on to help long into the future. And finally, there is also a lot of evidence that shows that physical activity reduces relapses and disease progression. So how much activity should you do? The recommendations for activity from national governing bodies suggest 150 minutes of moderate intensity activity a week. Moderate intensity activity is anything that gets you a bit warmer and your heart beating faster. It should get you slightly out of breath, but you may still be able to hold a conversation. An example of this target being achieved would be by taking a 30-minute walk on 3 different days and doing 20 minutes of housework or gardening over the course of the week. Alternatively, you could complete 75 minutes of vigorous activity. This might be going for a run, playing a sport, or using the stairs. In addition to being active, we are also encouraged to dedicate some time to building strength and improving balance on 2 days of the week. This can be done easily without any equipment, whether that is in a gym or in your own living room. At the end of the presentation, I will demonstrate 3 simple exercises you can do to build strength and improve your balance. Doing these exercises are important to keep your muscles and bones strong and keep your joints healthy. So what physical activity can you do? Almost any kind of activity that gets your heart rate up counts. This could be games with your family, household jobs like cleaning or gardening, outdoor activities on your own like brisk walking, jogging or cycling, indoor activities like swimming or water aerobics, structured group activities like dancing, yoga or Zumba, or sporting activities like bowls, tennis or badminton. The more you try, the more likely you will find something you enjoy. You might be surprised at the simple ways that you can include physical activity into your day without taking up time or interrupting your normal routine. These are simple ways to include physical activity into your day. Using the stairs instead of using the escalator or lift. If possible, walking instead of driving, and if you do need to drive, park further away from your destination. Standing increases your energy expenditure, so if you're sitting for long periods of time, break it up by standing regularly. Balancing and pacing are 2 very important things to remember when increasing your physical activity. People will have different reasons they are finding physical activity difficult on some days. It may be due to fatigue, soreness, or breathlessness. But it is important on the days you don't feel so great, you still do a little bit, whether that is doing lighter exercises or doing a shorter walk than normal. Pacing is not doing too much too soon, but also doing something on the days you don't feel as good. Some people can make the mistake of doing too much on a day they feel good and then feel exhausted the next day. Balancing is ensuring that even on these days, you don't do a lot more activity than you're accustomed to. Doing something is always better than doing nothing. Keeping up motivation after starting can be a big challenge, but there are some useful strategies to help maintain physical activity. Setting yourself goals can be the single best way to keep motivated, and it is a technique used by many other people. A SMART goal is something that is specific, measurable, achievable, realistic, and time-based. For example, in 1 week's time, I will aim to spend 15 minutes jogging around the local field rather than 10 minutes. Start with small changes like those mentioned earlier and build up gradually. This way, these changes are more likely to become a habit. Telling your friends or family that you're trying to be more active, or even including other people in your activity, can have an incredible effect on staying motivated. And one of the strongest methods of motivation can be to remember why you are trying to be more active and all of the benefits that it brings. There is a lot of support available online that can be utilised by anyone at any stage of their treatment. But if you have any other concerns or questions, contact your clinical nurse specialist or consultant. I want to show you some easy to do exercises that can be done anywhere with easily accessible things around the house. So this first exercise is something that's nice and easy to do. You can do this around your house on any chairs that you've got. You're just going to be sitting down on the chair and then using your arms, pushing yourself straight up, standing up nice and tall. And you want to repeat this exercise up to 10 times. Start with 10, and as it gets easier, you can increase how many repetitions you're doing. Also, to make it harder, just keeping your hands over the front there so you can stand straight up. You're not using your arms. This means you're just using your legs to stand up. And if it still gets easier, you can start to carry things to make the exercise even harder. You want to aim to do this a couple of times a day, as I said, starting with 10 repetitions. So the second exercise, you can do this on your stairs at home or anywhere that you've got a step. And you're just going to be standing up. At first, you can use your hands to hold on to something on the side, either a handrail, just stepping up onto the top. Make sure you come up to standing nice and tall, and then straight back down again, getting both feet on the floor. As this becomes easier, you can do it without using your hands, and try and alternate the legs each time. So going up with the right first, standing tall, coming back down, and using the left foot. Again, as this gets easier, you can start to hold items Just carrying anything that you can find around the house or wherever you are to make it a little harder. This is a great exercise to build up strength in the legs and also balance as well. Aim for 10 repetitions. The final exercise is a shoulder raise, so this is using the muscles of the upper arms, and you're going to just be lifting the arms up above the head, reaching right up towards the ceiling, and then bringing them straight back down again. Again, you want to do this really nice and slow and controlled, just lifting them straight back and then straight down. As this exercise becomes easier, you can hold something in your hands, something like a water bottle or whatever you can find around the house. You're lifting it straight up. Keep a little bend in your elbows when you're lifting up, and then back down to the sides. You want to stand up nice and tall and do this, and again, aim for 10 repetitions. And finally, some top tips to get active and stay active. Tell somebody else that you're trying to be more active and even involve them in activity. Keep a record of what activity you do and set yourself short and long-term goals. Activity doesn't need to be regimented. Start with small, regular changes and build up. Please listen to the other presentations from Princess Alexandra Hospital for more information on the other important topics for health and wellbeing with cancer.